Hi, Kristen. I appreciate you taking the time out of your busy schedule today to meet with me and talk to me about the social working field, primarily around the work you do at the hospital.
Of course, Katie, it's not a problem. What would you like to know?
How did you get started in this field?
Well, it started when I became frustrated in my old occupation and I decided I wanted to make a change. I had met with several social workers who helped my mother adjust to dialysis and transition to transplant. And seeing the level of fulfillment that they achieved by carrying out their duties made me research the profession. I applied to Metro State University's social work program, earned my Master's of Social Work degree, and the rest is history. I now work at 2 dialysis centers serving over 400 patients.
Wow, that's great. So what does a typical day look like in your job?
Well, as with most administrative jobs, the first thing I have to do is keep up with communication. So I have to start my day by reading and responding to emails or listening to and responding to voicemails. Once my emails and voicemails are cleared up, I am able to hit the floor. Sometimes patients stop by my office to discuss sensitive topics such as finances or sexual dysfunction, but the majority of my time I visit patients while they are in treatment. My daily rounds often include conducting psychosocial assessments of patients, educating patients on dialysis coping, and ensuring access to medicines, insurance, and transportation to and from dialysis. If a patient is lacking in a quality of life area, I work with the interdisciplinary team to remedy the issue. My part often involves helping patients apply for assistance programs for medicinal copays and insurance premiums.
Sounds like a nice, busy, full day. So what are the greatest challenges you face in a typical day?
Well, the most difficult part of the day is usually facing issues with patients in which you have no power to affect positive change. These are usually barriers to independence that are difficult to remove, such as heart failure, homelessness, strokes resulting in unusable limbs, and changes to Medicare have also made it difficult to assist patients because many referrals for services can no longer come from me or the nephrologist. Excuse me. Patients have to report to their primary care physician for anything not directly related to dialysis. So if a person needs to see a therapist, he or she must see a primary care physician and be referred from there.
Okay, so what skills does one need in order to face these challenges?
Well, I would say patience, perseverance, compassion, and the ability to say no when a patient asks for something beyond your capability, just to name a few.
Okay, so what advice would you give to someone who is pursuing a similar career?
Well, I'd say the top of the list is be a people person, be aware of your own biases. You will have to speak with lots of people on a daily basis, and these people come from several different walks of life. So if you're not culturally aware, you can easily and unintentionally offend people.
Okay, well, I want to thank you for taking the time to meet with me today, and I'd like to give you a copy of my resume, and I hope you'll keep me in mind for when a position comes open. I think I'd be a great fit.
Of course, Katie. Nice to meet you today, too.
Nice to meet you.